There you go. Got it. Hello.
Hello, hi there. My name is Carolina Fernandez. I'm the secretary editor for FSEP, Medical Student Council, and I'm here um, with a Q&A session interviewing two program directors. So I'm going to go ahead and allow them to both introduce themselves and say the program that they're representing.
Sure. So I'm Sarah Temple. I'm the program director for the Florida State University Emergency Medicine Program at Sarasota Memorial Hospital. Very long name. Um, I have been the program director since April, and prior to that, I was the associate program director for the first 5 years of the program. And I'll let Dr. Grant introduce herself.
Hi, I'm Ashley Grant. I'm the Associate Program Director. I've been the Associate Program Director since April. I came in as the Ultrasound Director when we started the program, and I am still also the Ultrasound Director as well.
Okay. Thank you, Dr. Temple and Dr. Grant, for introducing yourselves and for meeting with me today. And I'm
Absolutely.
excited to learn a little bit more about your program and for our members to also learn a little bit more. So before we go in and before I ask some questions, I just wanted to ask a fun icebreaker question just to get things going.
Sure.
So I know that, on long shifts, um, there's always certain things that you want to bring along with you that you must have. What are some must-haves that you need on your shift, and what you bring in your bag with you to get you through?
So it's probably not what you're going for, but for me, it's snacks. I get hangry and I don't function well. And as everybody knows, a busy emergency department shift sometimes means you can't go and get food. So it's like a known thing. I just always have snacks in my bag. Of course, I have like some medical stuff too, so I can do the doctoring part. But as long as like the snacks help me take care of myself so that I can be the best doctor and best teacher on shift.
Yeah, for me, it's caffeine. Caffeine is definite, must have on shift. I would say medically wise, I must have my stethoscope. I know as an ultrasound person, I should be like, oh, just use the ultrasound. I don't believe in that. I actually am a big fan of my stethoscope. So
I agree. If I forget it, and it like
doesn't
go
feel
see a
right.
patient, it
Yeah.
really doesn't feel right to the point
Mm-mm.
where I even go back and then
Yeah,
just listen
same.
to their heart and lungs.
Same.
So, yep.
Yeah. Well, yeah, thank you. I definitely agree. I think the snacks is a big thing and caffeine. And also it's interesting to say with what you mentioned with like you being like ultrasound. Um, it's sometimes like a lot of people just want to rely on the imaging rather than using like such a reliable physical exam tool. So I think that's really
Absolutely.
interesting. So I'm gonna go in and start off by asking a couple more questions just to get to know um,
Sure.
you both a little better in your program. Um, so now with application season with VSLO and applying for away rotations, I think a lot of students would want to know how applicants can stand out and on their audition rotation and what you specifically look for.
Sure. Honestly, I think it's actually pretty easy. Like the things that I'm looking for are all things that any student can bring to the table. Um, and specifically what I'm going to say is I am less concerned about medical knowledge because quite honestly, that's a lot of that is our job to teach you over the 3 years that you train with us. And I'm very confident in the educational aspect of our program. So even if you come in maybe a little bit behind your peers on medical knowledge, we're going to get you there by the time you graduate. So if you know the PERK criteria and you know Nexus and that kind of stuff, it's great. I'm happy. But what I really want to see is number one, a student who's excited to be there. Like so much of it is your um, interest and engagement on shift. Like I want to get the feeling from you that there's nowhere you'd rather be. And I will tell you, there are going to be days where it doesn't feel that way. And so that's okay. But this is a time where, that old fake it till you make it. Like, I want to feel that you're interested, that you're excited to be there, that you want to see the patients, et cetera, et cetera. That's honestly one of the biggest things for me.
Yeah. Everything that she just said, especially that enthusiasm and wanting to see patients and being self-motivated to see them. The other thing that's kind of a little bit more nuanced is having situational awareness. So, you know, there is a fine line between being that very eager medical student that wants to be involved in everything, but also you don't want to get to a point where you're like competing with the intern or the resident that's on. So you want to be a part of the team, you want to be helpful and all that stuff, but you also want to make sure that you're not stepping on other people's toes. And that's much more nuanced. That's a little bit harder for the medical student to navigate because you want to show that enthusiasm. But yeah, you
Agreed.
want everybody to enjoy you also.
And I think along that lines, I want to know that you're following up on your patients. So I want you to have the confidence and feel free to like, hey, Dr. Temple, the CAT scan's back on 4/13.
Yeah.
But again, it's knowing when the right time is. Like if
Yeah.
you see me like right in the middle of charting or, you know, something like that, that's not always the best time. But like I think sometimes students are following up on their patients. They know what's going on, but they don't communicate it to me. And
Yeah.
if you're not communicating it to me, I might make the assumption that you're not following up on your patients, which is another thing I think myself and any residency program
Yeah.
out there is going to want from you.
Yep. Another great way to do that is if we give an intervention in some way, like if we treat a patient's pain, go see how they're doing. See if they need more pain medication. See if they need more Zofran. You know, updating the patients on what the delays are and things like that can be really helpful as well.
I'm much more impressed with a student who takes thorough care of each of their patients than the student that sees twice as many patients, but doesn't remember to round on them, doesn't follow up, doesn't do the disposition discussion, that kind of stuff.
Okay. Yeah, it definitely makes sense. Just being proactive, seeing through with, you know, at least I think it's not about it's more about the quality rather than the quantity, and just making sure you follow through with each of the patients that you see. I agree.
Definitely.
And now we discussed a little bit about what you look for in a student rotating. You know, this is a student that's still in training, but I wanted to ask more of what a successful resident would look like in your program when they start at that level of training. What's, I guess, the difference that you want to look for in that particular case with the resident? How would they be successful in your program?
Sure. And I'm going to caveat your question by saying, like, I think to be a successful resident in our program, you need to come to the table with, you know, EM being the right specialty for you, you being a good fit, putting in the hard work and doing what's required of you, and you'll be successful. So I'm going to say to really thrive and go beyond the level of success, there are a few things that I think we love to see in our residents. And we're very happy to have a bunch of successful residents. We're even happier to have a bunch of thriving residents. So what I think we see as the difference between the two at our program is the residents who really thrive are the ones who don't want to just meet the minimum requirements. They've gotten all their minimum procedure numbers, but they keep logging all their procedures. They notice on shift that, you know, they've had a couple of arthrocentesis that they had to do and there's no order set. So they had to like manually go in there and find the, like, you know, cell count and the culture and this and that. And so they come to us and just don't say, hey, Dr. Grant, Dr. Temple, there's no order set for this.
Yeah.
Somebody should do something about that. They say, hey, I want to make an order set. I talked to Dr. Snitowski and we're going to put this together.
Yeah.
So it's the kind of resident that wants to sit on a hospital committee because they're interested in seeing what medicines are on formulary and what aren't.
Yeah, it's the resident that sees maybe a process that could be improved or a problem that could be improved and has ideas and ways to combat that or to participate or to provide. It's like that resident that kind of goes a little bit above and beyond just learning how to be an ER doctor. They're also being, an ambassador for emergency medicine in general and an ambassador for our group and our program and our healthcare system, things like that.
And I think the reason that that kind of resident really thrives here is that's our culture as a faculty, that's our culture as a program, that's our culture as a physician group, and it's the culture of the entire institution, the entire hospital system. Our hospital system, our group, none of us are ever satisfied with just minimum requirements or doing as little as we can do to achieve something.
We don't want to just be the ER doctor in the basement that doesn't even know how to get to the rest of the, parts of the hospital. We're all in committees. We're all involved in leadership. We all want to be at the table and helping to make decisions to improve our patients' care and improve our jobs. And
it seems like you want a resident that's willing to go above and beyond and be involved in multiple aspects in the ER and just be well-rounded and also just go above and beyond without, just not only doing the bare minimum, but really going out there and doing the best for, their training and in the future as an attending physician as well. So I did want to ask, what would you say your residents would say that is the best thing about this program, or what would you say that residents would highlight? What specific thing would they highlight about this program, or say what the best thing about this program is?
I have two ideas.
Yeah, I think there's a very kind of specific, obvious one, which I'll let you talk about, like the procedures and
So I mean, I think if you're thinking of what do you need in residency training, you need a good clinical learning environment where you're going to see lots of sick patients and get to do lots of good interesting procedures. And so when you look at the nuts and bolts of what you as a student need to get out of an emergency residency, I think that's what if you're looking at that aspect, our residents would say our clinical learning environment is 100% the best thing when you're looking at nuts and bolts of a residency program. I'll take just a minute to expand upon that. So we are a 900-bed hospital, so very large, very similar size to the big, fully academic quaternary care hospitals in Florida and throughout the country. We have 90,000 visits at our main ER and an additional 30,000 visits at our freestanding ER, so a very high volume. Nationally, the average admission rate is about 24%, and we're at about 34%. So that means our patients are much sicker than the average emergency department. We have trauma, comprehensive stroke, peds, all the things that you need to see. So I'm setting the stage for you are going to see a ton of patients, a wide variety of pathology, and it's all at our hospital where we just have emergency medicine and internal medicine. That's incredibly unusual. There is no other program in Florida like this, and I'm not honestly aware of many throughout the country that are quite like this with the very high volume, very high acuity, and just EM and IM. And so that means that you, as a resident here, every day on shift, you function as an independent community emergency physician, meaning you independently evaluate your patients, you work them up, you decide on the disposition, you do any procedures that need to be doing, because there's not very many other learners in this environment. And that is a very different training environment. And the procedure numbers that we have here are really impressive. And they back the idea up that this is the ideal learning environment.
We're not involving our consultants unless it's really an emergency. We're making the disposition, we're making the plan. And so when our residents transition to their jobs outside of residency, that transition is so smooth because they've been learning in that environment. And they don't have to, totally rethink how they practice. I think the other thing that our residents would say that's maybe less obvious and harder to put on paper is our culture and just our vibe. When people come to work here, when they come to work at Sarasota Memorial Hospital, when they come to work for our physician-owned group, they stay. We have a very, very low turnover rate. So when our residents start day one, the attendings that they start with on that day are the same attendings that they're going to see when they graduate. And if they stay here and work, it's going to be the attendings that they work with, well into their retirement ages, right? So We have quite a few physicians here where this was their first job out of residency, and this is going to be their only job out of residency. And that's incredibly rare in emergency medicine. And so we, I think, have proven that we kind of create this family culture where we all really get to know each other and we all really support each other. And it's because we've been working side by side with each other for many, 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 many years. And that translates through to our residents as well and shows that we value that culture.
Well, I wanted to ask an additional question just to get to know the program a little bit better. I know you talked about, the different types of cases that you'll see, and just the exposure that residents at your program will have. So I wanted to know, is the population of patients that you see, what is the characteristic of the patient population, and whether the hospital is community-based, population-based?
Sure. So I consider us kind of a hybrid. I would say we're sort of the best of all worlds when it comes to what kind of hospital we are. Technically, we're a county hospital. We're publicly funded. We're actually run by a publicly elected board. We are actually the last truly public hospital system in Florida. There are many other nonprofit hospital systems, but we're the only truly public one. So that's what we really are. We're a county hospital. However, I think when you think of county hospitals, you think of something different than what we are. We are really lucky in Sarasota that we are very well funded, and a lot of county hospitals don't have that situation. I love being a county hospital because it means we're truly the safety net and we're caring for the most vulnerable patients in this county and honestly a tri-county area. And I love being at a place where we really get to give care to the people who need it the most. So we have the benefits of being a county hospital without some of the potential negatives. We're very well funded, very well staffed. We have all the ancillary services you could possibly want. So we're county. But really functionally, I think of us as a big, busy community hospital. That's how we function. We have all the specialists on call. We have all the kind of backup that we need, but we still practice independently. But I still think of us as having an academic flair as well, because we are an FSU College of Medicine sponsored program. We have a very good research production. We've matched now 11 of our 28, 36 graduates, including this upcoming class. So we've matched a lot of residents into fellowship. So we still have an academic flair as well. So that's why I describe us as the best of all worlds.
And we're one of FSU's core sites. So we've had the FSU medical students here for how many years?
At least 15 and probably closer to 20 now.
Yeah. So this hospital is no stranger to GME, to graduate medical education, to that academic learning environment.
Okay. Well, thank you for all that information and for sharing all that. I think we were able to get to know a lot about your program. Now, I just wanted to ask a couple of other questions that students are always curious about, and which is it's also really important when they're looking into applying to specific programs. What would you say your program does to promote a culture of wellness for the residents?
Sure. I'm happy to answer that. I think that's another one of the things that our residents might say that is one of the best things about our program. So we really kind of approach wellness in a multifaceted way. So there's very practical things we do to promote wellness, one of which is going to be unusual. You probably haven't heard from other programs. As interns, we don't have you guys work overnight shifts in the ER. So you do a week, I think, of trauma nights on your trauma month, and then you have it usually ends up being 5 overnight calls, Q5 call on your MICU month, your MICU month. But other than that, you're not working any overnights. You do have swing shifts 4 to 2. The reasons for that there's multiple. Number one, intern year is hard. Transitioning into residency is difficult. This is one less thing you have to worry about, flip-flopping from nights to days to nights. Our overnight flow tends to be very busy. And I think when you're an intern, you benefit more from very intentional teaching. And then it is more difficult to get that sometimes on our overnight shifts. As a second and third year, I think you can learn more from osmosis, learning by doing, learning by seeing. And so I think it's a better learning environment for our second and third year residents. So that's one thing we do. We also have chosen to protect Wednesday afternoons for our interns. So when we don't ever schedule you in the ER after conference, because we have our conference didactics Wednesday morning. We don't schedule you on the Wednesday afternoon shifts, and we also kind of excuse you from other Monday through Friday rotations like OB and ultrasound. And the reason for that is we give the intern class that kind of protected time off to get together as a class and bond. And so we actually were just talking to our residents about how this class and the prior class, both of whom had those Wednesday afternoons off, they really took advantage of that. They got together frequently. They said Wednesdays were days they looked forward to. And so we will continue to do that. So those are two very practical things we do. We have a wellness curriculum where we, do all sorts of things. Panels from of our recent graduates of what they might have done differently or advice that they would have to the residents as they transition into attendinghood. We've done panels of our own attendings talking about cases they had where they had bad misses or just bad cases at all.
Going through lawsuits, things like that.
So we do more of the kind of sort of emotional support type wellness, but also really practical stuff like financial wellness. And we had a great talk in July on finances. So we have a wellness curriculum. And then we do the fun stuff like wellness activities, which I think some of our highlights are boat day. So in June, the last Wednesday in June, we invite all our new interns who are there onboarding. We have all our graduating seniors and everyone, and they're all invited out on a Wednesday afternoon boat trip. So usually 4 or 5 of our attendings bring their boat to pick us all up at the marina, and then we go to lunch, and then we go to a sandbar. We hang out in the water, throw the football around, et cetera, et cetera. Throughout the year, we have other really fun wellness events, kayak day. We have a post and surface party. We've done paintball. We've gone to spring training. We've done tennis tournaments, all sorts of fun wellness activities as well.
Things like that. Yep. And we also have kind of the more serious side of it where we support our residents with mental health and stuff like that. So they have the
employee assistance program. We have a first alert kind of system that if we're getting any kind of inkling that any of our residents are struggling, the Florida State residency programs participate in this system where our residents are texted periodically, like a one-line question asking how they're doing, and that helps me sort of have an indication of how the residents as a whole are doing, how the first years are doing, how the second years are doing, how the third years are doing. So we do that as well. We have quarterly meetings with each class. So myself, Dr. Grant, the chiefs in each class have a 30-minute just sort of concerns, events, check-in, announcements.
We also support the residents like in a lot of different ways. So financially, we really want to kind of get rid of any of those outlined like hardships and stressors that they get outside of work. So making sure they're well compensated, making sure their food is covered. They don't have to pay for parking. They get nice scrubs. They get white coats. We send them to conferences like every year, not just in their third year, and it's paid for. So we try
moving stipend, cost of living adjustments, all of these things are other ways that we support the residents' wellness.
That's really nice to hear. It seems that you guys have a lot of programs within the residency that help support the residents in different ways for their basic needs, and also just all the events you guys host. I'm sure just we're located in Sarasota, you have access to a lot of water activities. I did want to go ahead and ask a question in regards to moonlighting, because it's I know emergency medicine residency and has, I guess, the flexibility to add on and try to moonlight and add shifts. So I wanted to ask, how does that look like? Is that a possibility within your program? And if so, when and throughout the 3 years is that a possibility?
So if you are a graduate of U.S. medical schools, you can technically moonlight at our program starting in your second year. If you are a foreign medical graduate, there's just I think it's a Florida or national rule that you can't moonlight till you're a third year. I would say historically, though, our residents generally don't start moonlighting till their third year. By the time that they get their license and do this and that, it's end of second year or early third year when they start. So absolutely, we support and encourage our residents to moonlight. We do have requirements to be approved for moonlighting. They're not particularly onerous. They're things like be doing well academically.
Yeah.
Show us on your in-training exam, which is like a mock board exam you take every year. Show us that you're hitting the 50th percentile, so we don't have to worry that you need more time to study. Turn in your evaluations and your paperwork and do your ultrasound numbers. Our philosophy essentially is if you're doing everything that you need to be doing and you're doing it reasonably well, then you can take your extra time and devote it to moonlighting.
Absolutely.
If you're not hitting some of the things that you need to do, we want you to take that extra time and focus on the areas that you need to improve. So the way our process works is we as program leadership approve you to moonlight, usually sometime in the second year. And then our group will hire some of the residents to moonlight internally in the system at our walk-in clinics. The nice thing with that is it's the same EMR, so it's the same charting system. It's the scribes that we work with in the ER, and so it's a pretty easy transition for them to do. We do allow external moonlighting. We just haven't had a lot of people do that.
Okay. And then just to wrap up the Q&A, I wanted to ask one final question. What would you like medical students watching this video and applicants to your program possibly in the future to take away from your program? If there was one message you would like to say,
Yeah. So this is easy because we say that Dr. Grant and I have just gone through about 170 interviews in the last couple months, and we've said this to many of our applicants. We truly feel like, our slogan or our bumper sticker would be, if you train here, you can work anywhere. And this goes back to what we talked about earlier. Because of our work environment that is very much a community emergency department feel, where you're managing patients very independently and not utilizing consultants and relying on other learners or other specialties that you probably won't have in your real job. We really feel that our residents transition very well into anything. We've had residents stay here. We've hired at least 10 of our graduates to stay here, and they've done great. We've had them go to rural places. We've had them go academic. We've had them go into just other community shops, and
they're all very successful.
Honestly, it's surprising. It was surprising to me at first how well our residents transitioned, because I remember my own transition, which was fine and very typical, but incredibly stressful and difficult, and took me a long time to really get settled in. And so when I would reach out to my residents who had just graduated and it was September, October, they'd been out for a few months and they were like, we're doing great. Yeah, it's great. So anyways, that's our slogan. If you train here, you can work anywhere.
All right, well, thank you both for meeting with me and answering all these questions. I'll make sure to add both your contact information and the website of your program, just so our students can get access and look more into things if they're interested. So I'll make sure to add that at the end of the video as well.
Yeah, our website is really packed with a lot of information. We kind of updated it last summer and really kind of gave it an overhaul. It's pretty accurate and up to date. You can find us on VSLO if you're interested in rotating with us. We'd love to see you guys.
Follow us on Instagram, get some information there too.
Okay, definitely. I'll add the social media as well.
Yeah, that's great. Perfect.
Thank you.
Okay.